This is a presentation of a health program called Eat Smart, Move More, Weigh Less by myself, Carrie Hutchens. Eat Smart, Move More, Weigh Less is a 15-week weight management program, and it was developed using the small change model. It is based on an evidence-based strategies for weight loss and maintenance. These strategies are proven to help improve health and support healthy weight loss. Each lesson improves and empowers and motivates participants to live mindfully as they make choices about eating healthy and being physically active. It is delivered through an interactive, real-time format with a live instructor. The participants are able to choose which format works best for them, and these lessons are delivered weekly, and they are targeted to inspire and motivate people to overcome barriers in eating healthy and performing physical activity. In 2006, the NC Cooperative Extension established Eat Smart, Move More, Weigh Less, along with other health departments, such as the Department of 4-H Youth, Family and Consumer Sciences, and also the Division of Public Health are all main contributors. To date, over 150 classes have been offered, serving over 3,000 within the state online classes. Again, these are only offered to state health insurance holders. For the program goals and objectives, what we're aiming to do is to increase and maintain weight loss management through healthy eating habits and regular exercise. Some things that need to be changed, of course, is eating fewer calories, including a nutritional diet that includes fruits, vegetables, and whole grains, increased physical activity, and also being mindful of what we're drinking. Participants are aim to increase their confidence to eat healthy and exercise regularly on their own, making it a norm, not just something that they do for a specific diet. We want our participants to have a healthy lifestyle, something that they maintain. Some of those things would be eating breakfast regularly, controlling or decreasing portion size, cooking meals at home, and obviously watching less television or leading less sedentary activities. Social cognitive theory, this is our foundation, our theory foundation. Self-efficacy is the focus of this program. Participants are encouraged and motivated throughout the program. They're provided ways to help change their lifestyle. Participants need to manage and create a healthy environment, and this involves people that surround them, such as their family and friends. They are just as big a part of this as the participants are themselves. Because in order to have a healthy lifestyle, we have to have support. So the success depends on the participants themselves and their motivation and drive. Data from previous research has shown overall weight loss among participants and an increase in confidence to eat healthy and exercise regularly. In North Carolina, obesity, diabetes, and heart disease has been rising over the years. So our NC Cooperative Extension and the Division of Public Health, and along with others, created this education and motivation program that uses tools to create this positive correlation between overall health, exercise, and eating for our participants. Evaluation questions. There's different types of questions such as process and impact. These are based on information needed from the participants and staff. Process and impact questions that are used focus on both aspects that Eat Smart, Move More, Weigh Less program was invented for. So the confidence that participants need to obtain by the end of this program is a key question that we aim to find at the end of our program evaluation. Our stakeholders, once again, is the NC Cooperative Extension and the Division of Public Health. These funders created this program in the beginning to lower the obesity rate, the prevalence of diabetes and heart disease among North Carolina citizens. The staff obviously are the forefront of this program. They deliver the program and the education within it to the participants, and then our main priority is the participants themselves, because we want to help them to build the confidence in eating healthy and exercising so that they can maintain a healthy lifestyle. A needs assessment. For our needs assessment, our target areas, of course, are eating healthy, exercising, confidence in the participants themselves, and then, of course, the program implementation. We're looking at the participants and the program staff themselves. Interviews and questionnaires will be used. It is a randomized selection of participants and program staff. We don't want to just target a few. We want to try to get a wide variety. Participants are encouraged to complete the questionnaire at the end of their 15 weeks, and we encourage all participants to do that. An external evaluator will be used to compile data to ensure validity. So this data from the interviews and questionnaires will portray the needs such as improvement of quality of health, of course in the education provided, how the program is delivered, and the health outcomes of the participants themselves, and of course their confidence level. Our methods of data collection, which was mentioned previously, would be interviews and a questionnaire. These interviews will have in-depth questions that promote a deep thought answer, and so that it really portrays what the program is lacking, what it did better, and of course the questions are prioritized towards the participants, the confidence and overall eating habits and healthy living strategies. The questionnaire is data specific to the health outcomes of the participants from their journal that they kept throughout the program. It is delivered online so that every participant can participate. Limitations and, of course, obvious internal threats to validity. Staff and participants completing interviews and questionnaires in a timely manner. We only have a certain amount of time to compile data, so we want to get that data in, and we're hoping that all will do the interviews and questionnaires, but in reality, we may have a few that do not. Refusal from participants to complete survey or interview. They may not want to participate in this data collection or in the evaluation plan. Obviously, skewed or biased data collected from participants and program staff. If the staff did not like it, if the participants didn't like it, then, or if they had a bad attitude coming into it, then obviously that would be skewed data collected from them. And obviously, if they had previous experience with weight loss programs, then they would be skewed in providing data whether or not they liked it. Reporting on the results. It is imperative that this data gets back to the NC Cooperative Extension and Division of Public Health, because these are our founders and our funders of the program. So they need to take a look at what we done right and what needed to be improved. So this presentation of the report still needs to be given to all stakeholders except for participants at the same time to ensure understanding of what needs to be done next. So these recommendations made from the data should be carried out within the program, and the program should be adjusted to satisfy these results. We always want to keep improving. And of course, the program staff will have to be updated when these changes are made and educated on how to provide a better presentation of the program for our participants. Cost predictions. We look at the specific costs. Using an external evaluator obviously is going to be a cost to the program. And then, of course, staff to analyze and compile the data in order to create a report. We don't want to use our stakeholders because we definitely want to keep them out of it. We don't want any data skewed at all. Materials such as computers, papers, notes, and then, of course, time is of value for these people as well.